name is Whitney and I'm a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Today, let's watch a teeth cleaning on a patient with heavy stain and tartar. And before we get started, make sure to get my free oral care guide. Click the link in the description below or in the pinned comment to discover all of the essential components for an effective oral hygiene routine. This guide is an action plan for preventing and maintaining a happier and healthier smile. And having said that, for today's video, let's walk through a professional teeth cleaning appointment. So before you ever get a teeth cleaning at the dentist, your dental office should always have an updated perio chart on file for you. Here you can see the clinician spot probing the posterior teeth with the periodontal probe. If you would like to learn more about the gum check and the measurements, I'll link that perio charting video of mine in the description box below. After they have decided which type of cleaning is best for you, based upon both your periodontal charting and your dental x-rays, they will start cleaning your teeth. Most of the time, first, they will use something called an ultrasonic scaler. The scalers, the regular scalers, or the scrapers, right? Those are also called hand instruments, and those hand instruments are usually used after the ultrasonic scaler, and we'll see those in just a bit. But until then, here, the ultrasonic scaler that you see, we're using it now. It uses both high pressurized water and ultrasonic vibrations to help remove plaque, tartar, and stain from your teeth. And right now you're watching the full back side of the tooth. We call it the lingual side. You just watched it. It's finishing up right now. Go from a stained tooth to a clean tooth. That was kind of cool, right? I think it was cool. A good visual. So let's watch another tooth go from stained to clean with some sound. I know sometimes it was maybe a little hard to see perfectly in the mirror because of the water droplets, but overall pretty cool, right? So that same process will be done on all of the teeth, all surfaces, even where you don't literally see the stain, there can still be plaque and tartar that matches the tooth color. So when you're the dentist or the dental hygienist cleaning the teeth, you're able to feel for this tooth colored plaque and tartar. Oftentimes blowing air on the teeth also helps a lot. You know, it helps us to actually feel the grainy and clickable spots as well as see them a little better when the tooth is dry. If you ever wondered what the air does, I actually made a whole video about that. If you'd like to learn more, I'll link that one in the description box below as well. But now you can kind of see how we're making our way back to the posterior teeth now, but it's super hard to keep the camera focused when we're trying to film all the way back there. So just know that all the teeth will be cleaned with the ultrasonic scaler. Next up, let's show you the hand instruments, also called the scalers, also called the scrapers or the scrapey things. Some patients like to say that. So we use these hand instruments to fine tune and get into all the little crevices and little spots that we may have missed, or it was too hard to reach with the ultrasonic scaler, or that we just simply need to smooth out because there's little grainy pieces of tartar still. So that's what we're doing with the scalers. Let's play a clip of everyone's favorite noise. Saying that's everyone's favorite noise was of course sarcastic. It's so funny to me. Lots of people actually say it's like nails on a chalkboard. However, you know, there are some people that don't mind it, or they'll tell me actually that they love the sound because it feels satisfying to them. So who knows? But having said that, I've had people actually say they love the scalers more than the ultrasonic because of the ultrasonic's high-pitched noise. If they had to pick, they would actually prefer the scalers the whole time. But on the other hand, right, I've had patients say the exact opposite. They would love the ultrasonic scalers the whole time, all day, and wish that the regular scalers didn't have to be used. And of course, there's always patients who hate both sounds. But either way, it truly is making your teeth fresh and healthy. And by removing tartar, which is essentially bad bacteria sitting on your gums, using these instruments, whether the sound is music to your ears or not, they are bringing your gums back to health. So it's worth getting through it if it's something that doesn't sound sound great to you. And if it already sounds great to you, then more power to you. Lastly, if there's any residual stain, polishing is what will shine up and make your teeth sparkle again. Lots of offices will use the cup and paste, as you can see here, where you get to pick a flavor, and other offices will use an air polisher, which sprays out powder. Oftentimes it has a salty taste. Either way, after the polishing, they will floss and have you rinse, and your teeth will be good as new. Routine dental cleanings are so important so you can maintain clean, healthy teeth, like this photo. But what you do at home every single day in between your dental appointments is just as, if not more, important. So be sure to keep up with your daily routine of brushing and flossing at home, and if you're interested in creating the perfect routine at home, make sure to click the link in the description or in the pinned comment below to sign up for my free oral care guide. And I hope you enjoyed this video. Please like, subscribe, and turn on your notifications if you did. And if you want even more dental tips, you can hang out with me on Instagram at Teeth Talk Girl. Peace, love, and teeth.